Mr. Yip Hon Wing.
To reiterate, the cancer drug list CDL conferred negotiating leverage to MOH to lower the prices of commonly used and effective cancer drugs. Since its implementation, we have brought down CDL drug prices by an average of 30% and over 60% for some drugs. Today, the CDL covers about 90% of HSA-approved cancer drug treatments in Singapore. We will work with pharmaceutical companies to expand the CDL. For the remaining 10%, many continue to be able to tap on their insurance rider policies, which can cover drugs beyond the CDL. We also advise that patients and their families discuss the suitability of more cost-effective alternatives on the CDL with their doctors. If both are not possible and the patient is seeing a private doctor, the patient can consider transferring to subsidized care under public hospitals, where we will also explore the possibility of using additional Medisave and availing other forms of financial assistance. We are committed to ensuring that no one will be denied of appropriate care due to an inability to pay.
Mr. Yip.
I thank the SPS for her reply. My first question is on cancer services. I wish to ask whether the Ministry will consider allowing more Medisave use for patients who may need services like consults and tests for late-stage cancers. This is because some patients may want to tap on their Medisave instead of burdening their loved ones. Second, how often will the new cap of $3,600 a year for MediShield Life claim limit for cancer drug services be reviewed to ensure that cancer services remain affordable for Singaporeans? Thank you.
I thank the member for the question. Actually, the Medisave limit is usually sized to cover the 10% co-insurance of MediShield Life for treatments on the CDL, and the current limit is actually more than enough to cover the 10%. So we will not be reviewing this at this juncture. But if the subsidized patient faces financial difficulties, some affordability challenges after the subsidies, after insurance, and after tapping on Medisave, he or she can still apply for financial assistance. In respect of the question on the MediShield Life, actually we have just done a review of the latest data available, and we've actually raised the services limit quite substantially from $1,200 to $3,600. And this would actually cover 9 out of 10 subsidized bills in the PHI. And on top of that, patients with IPs or riders would actually have higher coverage, more than the 3,600 limit that is set. So we will continue to monitor this. We will continue to monitor the impact and review data. And if necessary, we'll adjust our policies accordingly.